Hi, everyone. My name is John Faulkner, and I'm your host of the Smarter Systems, Better Care podcast. I'm here today with Dr. Leah Hollon. She is the founder and Chief Naturopathic Doctor of Richmond Natural Medicine, and she's dedicated to holistic healing and integrative healthcare in Virginia. Thank you for joining us today.
It's great to be with you. It's lovely. Yeah,
Absolutely.
thanks for
And
having.
just to give our listeners context, tell us a bit about your background.
Sure, yeah. So I'm actually from Richmond, Virginia, pretty much born here, raised here, and I got my undergraduate in psychology at the Virginia Commonwealth University here in Richmond, and then got my master's in public health at the School of Medicine. Loved that. It was awesome. It was just really a wonderful experience. And it led me to naturopathic medicine. I just really believed in prevention and holistic care for people. Like, how do you help people take better care of themselves? You want them to be able to do that. And so it really naturally led me to naturopathic medicine. So I went and got my naturopathic medical degree at the National University of Natural Medicine in Portland, Oregon, and went to medical school there and then did my residency in primary care also there. So after that, I decided to teach in a pharmacy school. Loved that as well. A lot of pharmacists, people don't realize that they really would much rather do a lot of lifestyle stuff first and then give drug therapy. And our pharmacists are what keep a lot of us alive on the planet. They catch things where
Absolutely.
maybe other folks haven't. So I taught in a pharmacy school in Appalachia. That was a wonderful experience as well. And then I also teach at two other pharmacy schools currently at the University of Buffalo and also the University of Cincinnati, which have been wonderful experiences. My background is quite varied, but always based upon more precision medicine for people, holistic medicine, and just really trying to help people heal and also prevent further disease.
Yeah, that's amazing. You have quite the background and the pedigree behind you. So it sounds like you've done a lot of work to get here to where you're at. So that was lovely to hear. And what's the core focus of like your business today, and like how do you serve your clients?
Yeah, great question. I think it's what you said initially was, we provide holistic care for people. And so holistic care can look so different for each person.
Hmm.
If we think about individuals who, they come in, they've tried everything. That's a lot of the people that we see is that they have tried first, second, and third line therapies with unfortunately not having great results. And so the way that we are helping them is oftentimes working with their primary care physicians or their specialists to really try to give them more support. But yeah, there's so many times they sit down in the chair with us and they're like, I'm just hopeless. I don't know what else to do. I feel really sad. I'm discouraged. And so really trying to help them put things together. And sometimes it can be as simple as nutrition. And then other times it's much more complicated where they have truly failed drug therapy. And we have to figure out, is that like a genotype kind of thing? And trying to make sure that we get things even more precise for them. So, you might have 10 people who come for the same kind of cancer, maybe even have the same genotype related to it, but you're not necessarily always going to treat them exactly the same. And I think that that's really where we stand out here, that we really want to be personalized as much as possible. And so it's not just the physical body. We know that the emotional body has a significant effect on how we present with illness or disease or even wellness. Our thoughts make a huge difference. We see this in research too, and I think that's where a lot of medicine's coming together. I'm really excited about the future of medicine, but for a long time we've had a lot of compartmentalized medicine, and so I have a lot of friends who are medical doctors as well. And, they even feel frustrated, like, oh, I can only look at this part of the person, but I kind of know that this is also, so at least I've got a good friend who I can send them to for this. And so when people come to sit with us, we really, some people, when their cancer first set up, it was when they had a severe trauma that happened. And it's really important for them that they want to talk about the emotional health too. It makes a lot of sense. We really shouldn't be compartmentalizing our body. It's all related. So that holistic medicine, and finally, thinking about the spiritual aspects of things. And I think a lot of people recognize that that's a big part of how they want to show up in their decision making. And it's not mutually exclusive between maybe their religion and maybe even their politics or even medicine. Like, there's a way to find a really great path forward for each person. Sometimes we do have people who come in and are very sensitive to drug therapy. They've tried lots of things and they feel scared to try a drug. And sometimes I sit down and be like, listen, we know that you've reacted to these two drugs before. They go through these pathways. This one doesn't. Like, let's talk about this more and let's get your, and so, we're very personalized. So hopefully that kind of gives people a sense of how we allow people to show up. And our first visits are usually about 2 hours long. So we're really
Pretty
getting
extensive,
into
yeah,
the
comprehensive, yeah.
Yeah, really into the nitty-gritty. I mean, we wanna know everything. We want as much as we can, right? So, their background, what they love to do for fun. I remember one time asking a patient, "What do you like to do for fun?" And he looked at me like, "Are you crazy? I don't do anything for fun." And so it was really it was so cute, and he was in his late 80s, and he had been a Vietnam veteran, and I said, "Well, I want you to come back and let me know something that you might be interested in at our next visit, because if you can really get a spark about someone." And he had a heart condition, and his daughter had died 5 years prior, of cancer, and I had seen her for some time, and, he had kind of a broken heart, and it was like if I could kind of allow some of that emotional body to show up in a different way, and he was so cute. He'd, like, write things down. "This is what I did. I listened to orchestra music for fun this week," and it
Nice.
was adorable. Certain ways that we have to get people engaged of recognizing, that there's parts of themselves they've had to leave behind in their illness and maybe even in their healing process, and trying to pull that back in of where maybe there was some type of significant trauma so they can heal.
Yeah, absolutely. And it sounds like you're very passionate about what you do, and I'm sure that comes across very well to your patients. And even those that may not be immediately open to what you're asking them to do, but it sounds like they still take that extra step and make a point to tell you, which is exciting, right? Like you're resonating with.
Yeah.
So and
I
like
love
yeah,
Sorry. I love my patients. I mean, it's kind of it's some of them I've known them for quite some time, over a decade, and they're just I don't know, it's really a special kind of situation where, again, everybody wants to have a doctor that they just love to go to. I mean, myself included, and I do have one of those. All of us need one of those, even in medicine. We need a really great doctor. And I love being with them, and so that's the spirit that we try to create here, is just making sure that they feel like they're really listened to, and that it's almost like a family. We take care of people like a family.
absolutely. And when you look at your role too, like where do you spend the most energy kind of driving growth right now?
For the business specifically.
Yeah, specifically to the business and reaching out to patients and that sort of thing.
Well, I think one of the I have a couple things in mind related to this question, and it's multifaceted. Is really making sure that you have a really great team. And right now, I have an amazing team. I love my team. They are just incredible people, and I think really making sure that they have what they need and that they're well taken care of. We always go back to our core values of taking care of one another and ourselves, and also compassion and growth, and that professionalism. And I think that that's really where it starts, is with the team. And so if you've got that team, it's a lot easier to kind of grow and develop things. I would say, when I think about, you know, where we want to head, we want to make sure that we still have that great team, which includes my doctors that also work here, and that also includes, I have a new resident. We're the only residency for naturopathic doctors in the state of Virginia at this time. It is growing, which is really exciting, but really making sure that I'm fostering growth and development for them, and really training them. I want this new generation of providers to really have what they need to be thinking outside the box, to really be engaged. So I think that that's, when I think about what I see on the horizon, kind of maybe some of the challenges that can happen is obviously around HR. And then when I think about patients, I think sometimes when they come, immediately when they open the door, like, oh, wow, this is so different. This doesn't feel sterile. It feels very welcoming and inviting. And that's just so important to me. I was very conscientious about setting up an environment when they walk in, they feel transported into a new opportunity. I think all of us, it's not that it's like Disney World or something like that, but it's like that factor of like, oh wow, there's something very different about here. And if it's different, maybe there's a way I could show up different in my health to where I could actually heal. I could actually feel better. I might not have as much pain. And so I think we've been very strategic about how we have things set up, anything from our colors and that kind of thing, and what's on the walls and what's being played, of really transporting them to another belief and a new desire in their healing. So I think sometimes, there are some people that they walk in and like, oh yeah, this is different, but there's still a lot of skepticism for themselves. And because they've been in relationships in medicine, I mean, it's just like being in any relationship, right? There's gonna be great connections and not such great connections, and usually when they come here, they have expended a lot of their resources, and so there might be a little bit of skepticism, but usually by the time they walk out that door, they're like, "Wow, that was just really amazing," and so I think that can be a challenge sometimes is helping people really believe in themselves and recognizing that there's some the body has the innate ability to heal, it wants to, but sometimes we have to get out of the way,
Yeah,
and it takes a lot of work. You think about a family who might have diabetes and maybe grandmother had it. She had amputations. Oh gosh, my mother has, diabetes. I must be having, and there's a lot of fear that gets set up for people. And let's say, for instance, now they are looking as though pre diabetic. They actually have an old image of like grandma not having her leg.
wow. Yeah.
Right? I mean, and so, I think those are the challenges or some of those unconscious thoughts that they're not just saying, "Oh, yeah," well, they might mark it on their sheet like, "Yes, my grandmother had an amputation due to diabetes," but they're not really saying it. Sometimes we have to get in there and like, "Okay, what's really on your mind?" And they're like, "I just don't want diabetes." But then I have to go down a little
Yeah.
bit more of like, "Okay, yep, so your family has that, but like, what does that mean? Like, where is this coming from?" And then they'll finally share like, my grandmother had that happen, and there's, like, tears, and so now we get to another layer, right? So those are some of the challenges of, really getting into those emotional, pieces where people have perceived ideas about their health, and, well, if they have it, maybe that's what's gonna be my lot in life, or if there's alcoholism in the family, cancer in the family, that's a big one I have to really work with, and so those are some of the challenge that I would say is help people remember, I should say, that they're not their parent and they're not their grandparent. Yes, they have their genes, but what we're seeing with epigenetics is that that's just one part of the picture. Just because you are,
Not the
as
whole
one of
thing.
my colleagues says, yeah, one of
Yeah.
my colleagues, I love her dearly. She says, just because you got dealt a bad hand doesn't mean you're going to lose the game. And I have to really remind them of that. And my goal is that when people come in, they may feel a certain way, but when they leave, they feel like a totally different person. Feel informed and also inspired to engage in their health differently. I mean, even with stage 4 cancer, right? Like that's so important. Anyway, those are some of the challenges that, I think about related to patient care. And I think sometimes also because I work with so many folks who have failed drug therapy and doctors do send them to me, they may not know what to do, but there's something called pharmacogenomics. And I love pharmacogenomics. This is kind of my area that I teach in of looking at your drugs plus your genes. And again, it's not a perfect fit all the time with the science that we have. But we do have a lot of insight and research that says, hey, listen, this drug really isn't great for this person. They might have complications. And if so, maybe they're a slower metabolizer of this drug or an intermediate metabolizer, meaning maybe normally they take 2 Advil, but they should really take 1 for it to be as effective as it needs to be for them because they can't break it down. And so sometimes, and I can understand, especially in the world of oncology, is that that idea is scary, right? Because most of their medicine is also being dictated by an algorithm and also by insurance and malpractice, right? So, but a lot of times I have seen people being overtreated for a disease, which means they're being actually undertreated. Does
Yeah.
that make like overdosed or overtreated with the drug? And so unfortunately we're having negative outcomes where they're having growth or progression or those kinds of things. So they're being undertreated for their disease because it wasn't matched to them. So I would say those are some of the bigger challenges, especially since I see so many folks with stage 4 cancer.
Yeah. It sounds like there's so many layers in what you do as well, because you can cover one layer, and it sounds like you have three more things that you realize you need to work on as well. And it sounds like you probably have like long-term plans with your patients as well, as like you kind of lay out like, now we have all this information. This is where this is our goal for the next 6 months of where we want to be. It sounds like you might be laying that out as well. Is that correct?
Yes, most definitely, especially with cancer. So if someone's going to be on chemotherapy, radiation, even surgery, like we have certain things that we're doing, certain things that we don't do with radiation, maybe certain things that we do with chemotherapy, and then certain things that obviously we avoid during surgery and leading up to that, but also things that we want to do after surgery because even, the world is talking a lot about the microbiome right now.
Yeah.
And so, we know that anesthesia, radiation, chemotherapy dramatically changes the microbiome. So we have to really do a lot of work with that because if it's not where it needs to be, people will actually fail drug treatment. They'll fail chemotherapy if the microbiome is not where it needs to be. And what's also really cool is that we're learning is there's something with the microbiome called a bioaccumulation of drugs. So you might take, let's say, let's just say Tylenol, or let's say maybe an antibiotic, and that flora soaks it up like a sponge and holds it, and then later indiscriminately dumps it. Well, that also pertains to things like pain medication, right? Or you can even think about fentanyl. So, I do think in some cases, I've worked in drug treatment centers and those kinds of things, and in addiction or substance use disorder, where basically what happens is we see people overdosing, and they're like, well, I've done the same amount of this drug that's prescribed for X period of time, but maybe like their age is getting up a certain way. They're on a different drug now. They've had an infection, and then you've got bioaccumulation where they dump the drug and now they're having an overdose. So it's really interesting to kind of, like you said, we lay out plans that accommodate for those kinds of things like an infection if they're also doing chemotherapy, or if chemotherapy gets held and they're getting it for a good 4 to 6 months. That treatment modify things. And I think another example would also be for autoimmune disease, and also even certain types of infections like mycotoxins, or what we think about mold and those kinds of things from like natural disasters, including hurricanes. Yeah, we oftentimes will have that. And then sometimes they'll come in and they're like, you're not going to believe this. I feel so great. And they don't need, there's been so much healing that's happened. Like I have a number of folks right now with Parkinson's. I'm having great success with a number of them, but one is so striking. The first time he came to see me, he was on Namenda and Aricept, which we use for, dementia or can be used. And the aphasia, his ability to, speak and really even make eye contact was not there. So he was not making eye contact, shuffling, wasn't able to obviously to speak. And I just was like, I feel like we have a problem here. Like I was looking at a lot of other drug therapies. He also had 2 other autoimmune diseases. And sure enough, he was one of those people who cannot do Aricept or Namenda, and we worked with his providers. He comes back, he's making eye contact with me, full sentences. Yesterday, I guess 2 days ago, I saw him. He's like, "Look at my new shoes. Don't you like them?" I'm like, you can't imagine how much it like warms your heart. And we also realized that he did have something wrong within the microbiome. A lot of the research related to Parkinson's, we're realizing again, the microbiome is a big part of this. And for a lot of folks, there have been infections that have been there for quite some time related to Parkinson's that have to be treated. And we did do that for him. And that also, I think, made a huge difference. But he's smiling. He's telling me about, what he's able to do. And I mean, he can remember things. It's remarkable to see that when you're doing precision medicine, how people's lives can change. And like his wife was sitting here, with tears in her eyes. It's remarkable to see people change so dramatically. I mean, there's nothing better than that.
No, there's not. And it's just a great feeling to be able to help somebody and just move them forward, right?
Yeah,
Yeah.
it's excellent.
And then when you look kind of closer, like your day-to-day operations in your business, like when you're working with patients, like where do things feel clunky or kind of slower than you'd like to see that you're working?
That's a great question. I think there's been some interesting things happen within the United States, probably over the last, number of months. I said maybe even a year or two. Then there's that thing called COVID.
Yeah, COVID. Yeah.
We were very busy during COVID, actually. I think people really wanted to take health into their own hands. There were some people that we did have that maybe weren't good candidates for vaccination therapy at that time due to certain types of disease states that they had, and they really wanted to talk about, well, what else can I do to enhance my immunity? What can I do if I get sick or my family gets sick? And or the patient's like, I have stage 4 cancer. What can I do? So we were very busy during COVID, but I would say that over the last 10 to 12 months, I think there's been a lot more happening in the world. I think news, social media really distracts people from taking care of themselves. And it's like squirrel, 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 squirrel. And I think everyone feels a little bit overwhelmed. I mean, if you just go out there on any type of platform, you could be horribly overwhelmed within 10 minutes.
Yeah.
And that
Easily.
causes people to shut down, right? They either fight, flight, or they shut down. And it's really hard to fight a screen, right? So, I mean, obviously, some folks, they may, exchange, different comments or that kind of thing. But I think when that happens, or natural disasters or national disasters, what happens is things get quieter. And that's really when people need more support. And that is what we have noticed probably the last 10 or 12 months is that I think people are so overwhelmed that they shut down and they don't ask for help. And then when they do come back, they're like, I should have reached out. This is wrong. This is wrong. This is wrong. My kids are a mess, like, and they really needed more support earlier on. And I think sometimes when we're in a fight and flight kind of state, it is hard to tap out and say, hey, I need some support. So that's where we've had, I would say, some challenges where we have noticed, like, if there's, I mean, I hate to say this, but if there happens to be like school shootings or some type of violence that's happen within our world or nationally, we won't hear from people when it's the most important for them to take care of themselves. And so I have this sort of analogy of like, we stay in our lane, just like we're on a highway. We stay in our lane.
Yeah.
We don't rubberneck when there's an accident on the side of the road, and we don't get crazy and start going 90 miles per hour, weaving in and out of traffic. That's not what we do. We just stay in our lane and we keep driving and, keep everyone safe that's within the car. But yeah, I would say, as far as our business, we have definitely seen, and a lot of my other colleagues, small businesses, they've seen about 20 to 30% reduction from where they were last year. And I think that's probably, and that could be in a lot, not just medicine. I've seen that kind of across the board. So yeah, I want people to remember that when it's the hardest is when it's also the most important to take care of ourselves.
Yeah, like, and it gets into my next question too. Like, how do you keep your patients engaged in their care? So, like, making sure they don't just come for the 2 hour visit and then just never come back. Like,
Yeah.
what does that process look like as you're
Yeah.
working to keep them engaged and interested? And how does that work?
Well, I think because most of the people that we see have chronic disease. I mean, we do see some for general wellness support or, family medicine or that kind of women's or men's medicine. But for the most part, the individuals that we see are probably have more of the rare, strange, peculiar diagnoses or they have chronic disease. And so because they have tried everything else, they are much more engaged. I would say they are here because they want to heal. And I think that that helps quite a bit. The second part is usually when we see a new patient, as you said, we kind of lay things out of like where we expect to see things. Like I will share, tangible goals for my people. So especially if it's an autoimmune disease, or if it happens to be some type of, anaphylaxis that they've had for a period of time, I let them know it is a gradual process. The body just doesn't wake up one day and say, okay, all better, right? Like
No.
it's taken a while to get there. And again, the body oftentimes craves the known, even though it's not the healthiest. And so the body wants to go back to that old known. So I try to really share with them, like, okay, when I see you in, 4 to 6 weeks from now, especially for their new, their follow-up appointments, sometimes it could be 8 or 12 weeks, depending on what we're working on. I anticipate seeing this X amount of change, like 10 to 15%, especially if it's like an autoimmune disease. And if I don't see that, then we know that there's something else also going on. And a lot of times they'll come back, they're like, oh my gosh, I'm 30% improved. And so I think by giving them some structure, but also giving some openness at the same time and being like, listen, every person is different. But this is what I would typically see. I think that they really appreciate that. And I think because we communicate very well with them, we give them a plan. It's not just about supplements or testing that they need to have done or collaborating just with their doctors, but also their lifestyle. We spend a lot of time on that. So I think that helps. Sometimes people are afraid to come back. They're like, I didn't do all of the plan. I only did like part of the lifestyle. And it's okay. I let them know that it's a process. So I think by letting them know, like, especially when we're talking about chronic disease, it might take them 18 to 24 months to really be that new person they want to be, but also recognizing that there can be some bumps along the road. But if, a lot of times if people are really engaged, it's sooner than that. But also let them know that, again, it is a process. And you talked about challenges earlier of like that sometimes we will get people who are like, okay, why am I not better already? It's like, well, it's been 2 days. It's going to take a little bit longer. So that's kind of how we keep people engaged. We also have newsletters that go out regularly. We stay engaged also with social media. We send things out to them, posts, those kinds of things. So we try to stay engaged with them. And, if there's someone we haven't seen in some time, we kind of know who those people are. We reach out to them. I kind of do that personally sometimes, but we also
Yeah.
have like a quarterly newsletter that we kind of help them with. But yeah, so once in a while I have people who say, my gosh, I've been doing great until just recently. And I realized it hadn't been a year and a half since I'd seen you, or 2 years, and I have this other thing. So, I think people know that they get to experience something very different here where they can definitely reach out. Like, for example, I had a patient over the weekend who's exposed unexpectedly to asbestos, her and her son, and she was extremely concerned and upset. And so immediately, I mean, it's not like the first thing you think about on a weekend, but she needed to know what to do right away. And so even for something, that they didn't normally come in for, but there's a new event that's happened in their life, like someone having a new child or having a death in the family, those kinds of things come up and they always know that they can reach out to us for any change.
Yeah, that's a wonderful outlet to have and to call upon when needed. So that's great that you do that for your patients. And if you solved like all these bottlenecks, or able to get them to come in when you want, follow up when you need to, what would success look like for your practice in the next 6 to 12 months? Like, where do you want to go?
It's a wonderful question. And I think most business owners, they're always doing their KPIs and they're looking at their
Yeah,
strategic plan. and and it's been interesting as I shared, over the last maybe 10 or 12 months. I think that we've had more strategic planning meetings than we've had in the past. Um, but one of our main KPIs is really our retention of our team. Again, I think success of any business is having a strong team. I mean, having strong leadership. And that's what success looks like to me is, making sure that I'm being taken care of by my people. As I shared, like my own healthcare providers and making sure that I have good support around me and that I'm taking good care of myself, whether it's exercise, diet, my meditation, those kinds of things, making sure that I'm walking the walk on a regular basis. And I think the success is also making sure that my team has that support. So we've done a lot of different trainings for them over time. And I would say one of the most successful ones has been more recently where we're doing something called neuro change solutions. So it's really looking at those unconscious thoughts that are just out in the background. And, but maybe a patient calls and it's a really hard case that's on the phone and, they're really having a hard time, they're crying, how I can make sure that my team members can stay really solid without feeling like they're going to cry themselves, and of course we're empathetic to many people, of course, and that's how we're all designed in our humanity is that empathy. But also, when things don't go right, if we have something that maybe is unexpected, a system issue, IT's down, or maybe somebody didn't get a supplement or get something that they thought that they got, or there was a disappointment, really making sure that my team, they feel like they can make solution based, you know, techniques to pull in and that they can rely on each other as teams. I would say that is definitely success. And I have that right now. So I feel like a very lucky girl.
yeah,
Really, really blessed and grateful for that. And I think a lot of that came from doing my own internal work. And I'll just share a little personally. Like, I think growing up sort of in fear, I don't know. I think it's kind of like in our family line, there was always the worrier in my family. And I think I picked that up, whether we want to call it nature or nurture or something in between of epigenetics. I don't know. But I think early in my life, I really felt a lot of fear, even as a child, like stomach aches, that kind of thing. And realizing that I didn't feel stomach aches as an adult, but I would be the worrier. I'd have like a million things on my mind. And that's not healthy or loving for myself. And what am I going to be able to do it? The most important thing I can do is be present in this moment, right? What happened yesterday is not going to necessarily help me in this moment. And what I think is maybe going to happen in the future is not going to help me in this moment. And that's the blessing, right? Is really just living each moment like to its fullest. I know we talk about that, but I think doing some really deep inner work on myself is what allowed me to change myself in some ways to where all of a sudden I have this amazing team. I mean, like the dream team I've always wanted to have. So that success of us taking care of one another, really making sure that we're doing that self care, which is again one of our tenets or one of our values for our core values for our business. But I also think, still keeping amazing quality that we've been doing with our patients. They're happy. We're always asking them as soon as they leave here, they already have something that says, how was your experience in their inbox? We want to know. And we get feedback every week about how we're doing. And I think, of course, with any business, you want to make sure you're reaching more people. just continue that amazing medicine. And then also really trying to make sure that no matter what's going on in the world, that we're still reaching people who really need our support, and finding different ways to do that and integrate it a little bit different. And then also our new residents. So that's going to be success of, training a brand new provider in Virginia. And she has never lived in Virginia. She has been living on the West Coast and had full prescribing capabilities in a licensed state, whereas in Virginia, we are not a licensed state for naturopathic medicine. And so, really helping. There's so many people we can help without having the abilities to do physical exams or those kinds of things. We rely on our other providers to help us with that. So I would say that that is success, just having more and more collaboration. I would say there's a lot of challenges in medicine right now, right? So we're seeing so many providers retire early or leave medicine altogether. Right now, if I needed to get someone into a primary care, it could take months. I mean, I've had some people, they're waiting for a specialist for 20 months.
Wow, that's insane. That's way too long.
It's way too long. And so, we have, wonderful providers in our area. And maybe that's one thing that would be success. That would really be beautiful. We've been working on that for 20 years.
Yeah, that would be amazing. And, as we're at the end of the podcast here, where can people find you and connect with you and have like a deeper conversation if they want to?
Sure, yeah. So people can look at our website. It's just richmondnaturalmed.com. And we have a lot of blogs on there. We have so much content. We actually just updated our video recently, which should be out just shortly. We've just kind of freshed our website. The other thing is, I just recently wrote a book about a lot of the things that I see for folks with chronic disease. And it's called Unwinding the Imprints of Disease, Transforming Intergenerational and Transgenerational Trauma. As we had talked about earlier, trauma is a big thing that really affects what's happening in the DNA. So that's another way that's kind of low-hanging fruit for people if they want to kind of know a little bit more about how we look at things. So yeah, those are some of the ways that you can check us out.
Excellent. Well, thank you for your time today. It was a wonderful discussion.
Oh, thank you so much for your time. It was great being with you.
You as well.